The Elton John AIDS Foundation is one of the world's leading non-profit organizations focused on HIV prevention, stigma reduction, and direct services to people living with the disease. The credibility and reputation we have developed over 18 years in this field, together with the visibility, passion, and activism of our founder, Sir Elton John, give us a strong vision and a unique voice as an international leader.
This is an epidemic that must be cured, not only by a miraculous vaccine, but also by the difficult work of fighting stigma and through a collective effort to break down barriers and to build bridges where they once stood.
We advance public dialogue on critical and controversial HIV/AIDS issues. We challenge misguided policies and attitudes that block progress in HIV prevention. And we leverage the power of the media, celebrity support, and cause marketing to raise dollars for urgently needed programs and awareness about the continuing challenges of the AIDS epidemic.
I started the Elton John AIDS Foundation in 1992. There are 33 million people living with AIDS throughout the planet. There are over 1.1 million living with HIV and AIDS in America that we know about. And unfortunately, the infection rate is going up to nearly 60,000 a year, which is a big increase. So it's not getting any better here, it's getting worse. So we need to do something about it.
It's been 20 years since a young man named Ryan White died after struggling with pediatric AIDS. Now, he taught the world not only a lot about AIDS, but also about dignity and acceptance.
In April of 2010, we commemorated the 20th year since the tragic death of Ryan White, and a memorial concert by Elton John.
The fight for my son's right to learn in a classroom, like every other child, plunged our family into the national spotlight. For 5.5 years, Ryan educated children and families about AIDS.
The strong friendship that developed between Ryan White and Elton John was largely responsible for the eventual establishment of the Elton John AIDS Foundation. Perhaps more than any other person, Ryan White drastically changed America's perception of the HIV/AIDS epidemic.
And they did more, I think, to educate the population than any Surgeon General could have hoped to do. He wanted to use this publicity to educate people, you know, and he was 16 and 17 years old at the time that he was doing this. And he wasn't a homophobe.
The last moments of his life made me realize how godforsaken my life was, and I changed. But without Ryan, I don't know what would have happened to my life.
August 18th will mark the anniversary of the Ryan White CARE Act, which has brought billions of dollars to the front lines of battling HIV and AIDS in communities throughout the country.
It took a young child to die before the government in this country did anything to help anybody with HIV and AIDS.
Losing a child is the worst pain any mother could ever go through. Everyone told me, they said, oh, it'll get better. It doesn't get any better. You learn to live with it, and you learn to live with it because you have to, not because you want to.
We have to be the ones who keep doing what Ryan was doing. And what Sir Elton has been doing is to keep reflecting back to the society and letting people know that they are the ones that either have a problem with AIDS or HIV or sexuality or they are homophobic, and we have to keep being the demonstration for that.
Ryan's honesty, courage, and compassion continue to significantly impact the welfare of people living with HIV/AIDS through the Ryan White CARE Act and through the many non-profit organizations like the Elton John AIDS Foundation that arose in response to his example and to carry on his legacy.
If you dwell on the fact that you're going to die, then you probably will die, because, you know, they say a positive attitude can help you with anything.
Over the past 18 years, the Elton John AIDS Foundation in the US and its sister organization in the UK together have raised over $220 million in support of worthy programs in 55 countries around the world. In addition, the Foundation's investments in the US have helped to leverage over $127 million in additional resources for this cause through challenge grants with the National AIDS Fund and productive partnerships with other like-minded organizations.
Over 7 federally funded research programs have shown that syringe exchange can be effective in reducing HIV incidence, but also studies have found that it doesn't promote drug use and it doesn't lead to increased crime in the places where syringe exchanges are present.
On December the 16th, 2009, President Obama signed a new federal appropriations bill that for the first time in over 20 years did not include a ban on the use of federal funds for syringe exchange programs to prevent the transmission of HIV amongst injection drug users.
Last year,
we lifted the ban on federal funding for syringe exchange. In doing so, we are building on the extraordinary efforts of organizations like the Elton John AIDS Foundation to invest private funds in effective syringe exchange initiatives.
Syringe exchange is also an opportunity for people to get into care, to get services that can help them quit drugs or to get other health services. So it's really a window into a variety of services that people need.
This legislative victory was the direct result of decades of research, education, and advocacy on the part of a determined group of nonprofit foundations dedicated to this cause, including the Elton John AIDS Foundation.
You know, it was really important that the Elton John AIDS Foundation saw that we had a tremendous advocacy opportunity here last year and was able to put funding behind that, and we really were able to get the job done.
Since the very beginning of the epidemic, gay men have been and continue to be disproportionately impacted by the disease.
The number of AIDS cases, especially among young gay men, is on the rise.
Gay and bisexual men account for 53% of all new infections in the U.S. However, black gay men are more than twice as likely to be infected as gay men of other races and ethnicities.
African Americans are more impacted by HIV than any other racial ethnic group.
The Elton John AIDS Foundation has been a significant funder of HIV prevention and service programs targeting gay men since its inception. In fact, we've invested over $3.8 million in grants for this population from 2006 to the present.
This is not about somebody else, this is about us.
We recognize that serious challenges exist in mobilizing any population, especially gay men. That's why we're partnering with the Kaiser Family Foundation and the coalition of major media companies they have gathered into the Greater Than AIDS campaign to deliver targeted messages to gay men and particularly black gay men.
One test, 1 million people, that's the goal.
These messages challenge stigmas and taboos, mobilize individuals to action, and direct men to online and local community resources.
I talked with my boyfriend about getting tested.
We're also launching a new $1 million targeted grant initiative to provide more resources for AIDS services organizations to scale up direct services to gay men and take campaign messages into communities and neighborhoods across the country. Just beyond the U.S. borders, the Caribbean region has an exploding HIV/AIDS epidemic. Beginning in 2006, the Elton John AIDS Foundation stepped forward as one of the few philanthropic organizations funding HIV prevention, stigma reduction, and treatment services in the Caribbean.
To get this program started, they initially started by trying to change perceptions in the Haitian community about sexual minorities.
For people living with HIV, it's difficult to even make a diagnosis, to be able to get people to come in for care. And once we've made the diagnosis, the economic challenges have just increased.
So far, we've invested over $5 million in a broad array of projects across the region.
We use the HIV money to strengthen the infrastructures.
I would say building capacity, staff, and recruit a lot of staff and get them to stay to work with the community.
When anyone receives funds from donors or when anyone is generous enough to give us their money, we have to make sure that we are accountable both to them, but more importantly to the people we're trying to serve. It's medical care, psychological care, social care. That means that we're able to battle against discrimination for certain diseases.
In January of this year, a massive earthquake struck Haiti. Tens of thousands of people were killed or injured, including many healthcare workers. Much of the healthcare infrastructure and supporting services in Port-au-Prince and the surrounding area were destroyed.
In the aftermath of the earthquake, the government first set up an 18-month plan. So it was their interim plan to be able to focus on what was necessary right after the earthquake.
We immediately assessed the status of our grantees in Haiti and provided $200,000 in emergency funding to help them continue their work.
Many people left Port-au-Prince after the earthquake and came to their families in the countryside. So really the big pressure is an increase in the number of people we're seeing in our clinics and an increase in the economic pressures that they have in terms of trying to take care of their families.
Recovery from this earthquake will take years. Prior to this disaster, Haiti had been making significant strides in addressing one of the most serious AIDS epidemics in the region. Going forward, we will continue to emphasize the need to fit HIV prevention and treatment services into the short and long-term goals for the rebuilding of Haiti's health infrastructure. Addressing a complex and continually evolving global epidemic like HIV/AIDS takes vision, the kind of vision exemplified by Ryan White and Elton John. The kind of vision that sustained the far-sighted organizations that labored for so many years to repeal the ban on federal funding for syringe exchange. The kind of vision that guides the Greater Than AIDS campaign. The kind of vision that encourages the determined groups working to restore HIV/AIDS services in Haiti. The kind of vision that inspires the supporters of the Elton John AIDS Foundation. Working together, we can make a difference.